As we've discussed, when your kidneys have reached stage 5, or they're not working below 15%, below 10%, and you have symptoms, then you have to go on to dialysis. It is very important to see a nephrologist or kidney doctor if you have advanced kidney disease, because you can then begin your discussions about dialysis in advance. Dialysis is of two types. One that is done through the blood or hemodialysis, and the other is done called peritoneal dialysis, which is done through the stomach. The two are very different. Their outcomes are similar, but yet they have their own advantage and disadvantage. For the hemodialysis, you need a vascular access or an AV fistula put in, and then you have to just go to the dialysis center closest to you 2 to 3 times a week, where it's a 4-hour session. So for 3 times a week, you are on the dialysis machine for 4 hours at a time, and the machine will clear all the blood. And the technicians or the staff there will take responsibility for most of it. The other form of dialysis is called peritoneal dialysis. So basically you put in a catheter in your abdomen, in the stomach, and the catheter is left there. It's like a silicon pipe that comes out of your stomach, which is sitting there. इसके अंदर आप clean dialysate या फिर clean water बाहर से डालते हैं. That clean water or dialysate will stand in your belly for a couple of hours. वो अंदर अपने आप आपके टॉक्सिन्स को निकाल लेगा, and then after a few hours you drain out that dirty water from the same pipe. You do this like 3 times a day. Just as you have 3 meals a day, you do 3 rounds of dialysis a day at your home. So the great advantage of peritoneal dialysis is you don't have to go to the hospital. You don't have to be stuck to a machine 3 times a week for 4 hours. You can drive your own care. If you are living a very active lifestyle, you have a lot of hobbies, you are working actively, you can continue to do dialysis at home. You don't have to go anywhere. All you need is a catheter put into your stomach, and then you can do it either 3 times in the day. There are also other forms of machines that you can attach at night. So this is called peritoneal dialysis. So like I said, they both have their advantages and disadvantages. If somebody asks me, sir, is one better than the other? Like I said, PD can give you a better lifestyle. You don't have to go to the hospital, lesser risk of infections and other things. But at the same time, when you talk about the research or data, both HD or hemodialysis, yani blood wala dialysis, and PD, pet wala dialysis, peritoneal dialysis, they both have equal outcomes. As in, all the research says कि दोनों के outcome या result बराबर हैं. You're gonna live the same lifespan, you're gonna have the same complications and things like that. So both are equally good. It all depends on your lifestyle and your choice.
Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.